So we started the fellowship 6 years ago, and there's a shortage of geriatricians in the country, and Idaho's no exception. So the goal was to train more geriatricians for Idaho and for the Northwest. Anytime you have a fellowship in your residency, it really raises the level of training in that subject area for everybody, for the residents as well. So yeah, through the fellowship, I think we've at least doubled the number of geriatricians in the state of Idaho, which I feel really good about.
The year as a fellow was great. It was a chance to really focus on the things that I'm particularly interested in and things that I recognized that I needed to learn more about when I was out practicing. So there was a lot of flexibility, but also a lot of opportunities to work with a variety of different people in the Valley who work in geriatrics. Flexibility in terms of going to conferences.
We send them to a great review class down at UCLA. We send them to the American Geriatrics Society, where they learn a lot and they do a lot of good networking with geriatricians around the country. And we also send them to AMDA, which is the American Medical Director Association.
Yeah, it was really refreshing because I sort of rekindled my interest and passion in medicine by virtue of some of the freedom and flexibility I had and the time I had to sort of delve into things a little bit deeper. So it was great, yeah. There's quite a bit of flexibility, but generally speaking, we break it into 4-week blocks. We initially generally focus on psychiatry and neurology and some subacute rehab, but then mixed in there's longitudinal experiences.
They have a half-day of clinic here where they're doing their family medicine, and that allows them to maintain their skills that they develop while they're residents. Then they have a half-day of, it's a geriatric focus clinic where they're seeing all patients over 65. And then a half-day a week they're doing referral clinics here. One is a geriatric referral general geriatric referral clinic, where they have patients referred to them by other providers within our group. Point of this fellowship that I really stress is that we really try to tailor-make this fellowship to the interests and the needs of the fellow. If they have specific interests in different areas, we'll focus on those areas. We'll have them spend more time in those subspecialties or in those areas.
So we try to focus most of the training with geriatricians, with providers who are doing what the fellow will ultimately be doing. Being
a fellowship director, I've been very, very pleased with the response I've gotten from the community, especially the subspecialists. They are eager to work with the fellow. They're very supportive of the fellowship, and I really haven't had challenges setting up these rotations. They've really welcomed the fellow and the fellowship with open arms. They work with nurses and hospice and wound care and other settings. They work with pharmacists. They work with nursing home staff. They work with the other faculty and residents here at FMRI.
A good candidate for this fellowship would be somebody who really has an interest and passion in working with older adults. I think that's really it. It could be somebody who's coming straight out of residency. It could be somebody who's worked out, been working in medicine and wants to do something different or has recognized that they are particularly interested in geriatrics. We're definitely getting an influx of a lot of older folks, specifically people coming from California, are moving here because of the cost of living, because of the less population density. So in that respect, I think it's a good place to be in terms of potential job opportunities and things like that for somebody thinking about the fellowship.
I think we match up well compared to other fellowships around the country, and we are very receptive to feedback from the fellows and, again, fellows' specific needs and desires, and we're able to tailor make a fellowship to make this year the best year that they can have learning geriatrics.